So, how tiring does your work get? How about 16 hours or more a day straight, making life or death decisions that impact who lives or who dies? Everything from stab wounds, car accident victims, pregnant mothers in distress, end of life stage patients, maybe with dementia, patients with gaping gunshot wounds. It's just another day in the emergency room, right? But there's simply not enough of you. And at times, even when your shift is over, you can't just leave. You swore an oath after all. So you do the backbreaking work. I mean, at least you'll get paid for it, right? No, wrong. As pressure mounts on the Gauteng Department of Health, budgets have been slashed, and that means doctors are finding out that even though they're expected to do the work, there is no money to pay them for overtime. So many are now warning of mass resignations, legal action, and even service withdrawals as hospitals already thinly stretched face the prospect of losing critical after-hours care. It's a crisis that could leave patients waiting months for care and junior doctors without the supervision they need to train safely. And as I said earlier, the decision makers, what hospitals do you think they go to? We're joined now by Dr. Mzu Nodikida, who is the CEO of the South African Medical Association, to help us wade through all of this. A pleasure to have you on the show. Welcome to 702 Breakfast.
Thank you so much for having us. We really appreciate the opportunity. Thank you.
I've described the situation that faces many a doctor, particularly in emergency rooms, to do all of that backbreaking work, saving lives, and then to be told no payment for you for overtime work without an explanation. What's going on?
Yeah, so I think this is almost like unheard of. This is one of the professions that deals with one of the most serious businesses, that of saving lives. So we think that it should be taken or be given the respect or the seriousness it deserves. Just to bring this into context, Bongani, I think the South African medical program, both under and postgraduate training, is globally renowned. Okay, so this is one of the best training programs that in the world we have. This is why you've got people traveling from all over parts of the world to come and train in South Africa as supernumerary registrars.
Yeah.
Okay. Now, the arrangement of doctors working after hours is not only for service delivery, which is one of the core things, because South Africa has got less than half a doctor for 1,000 population. So that means there's one doctor for every 3,100. That's in the cities. As you go into the rurals, that ratio goes even bigger. Besides, for now, it's just besides the point. And South Africa has got 10 central hospitals, which are the main centers of referrals. This is where you actually teach.
Yeah.
One of them is Dr. George Mukari. So this is one of the centers for the most complicated cases that you can think of. So if services is affected there, and if you've got a problem in Tembisa because of the fire, we must commend the Gauteng department on paying the doctors in Steve-Biko. The doctors in Steve-Biko were paid, but now they're receiving every emergency case that would have gone to these centers that are now not operating optimally. And the doctors there are actually burnt out. So this, it's about lives of people. The reality on the ground is that people are not getting the services that they're supposed to get, this one. But it also threatens the very foundation of rendering those quaternary services that are needed for our people. It also threatens the very foundation of our own medical training. So this is not something that needs to be taken lightly, not only in Gauteng, but I think it's just that you've got some sort of leadership that came out from the ministry. he really came out and said, look, I've got a ministerial advisory committee that will deal with the policies that relate to HR, just for them to be updated and reviewed. He appointed people. So we just wanted provinces to stay out of it, for now, and allow the MAC to do its work, allow us as professionals to actually do the research and make our own submissions to the MAC and how these policies can be changed. Now you've got people trying to make changes, and you've got system glitches that affect directly the lives of people.
I understand, Doctor. I understand one of the things that has happened is that contracts with doctors are being changed. They're being pressured to sign new contracts without their consent. What does that mean for the doctors in the system?
It's frustration. It's really frustration. I mean, doctors have worked this way, since the introduction of the OSD. So what is happening, Bongani, is that doctors have the type of service that they render is 24 hours. Okay. But you don't have enough doctors, so you need the doctors to cover up. So the contract allows them to work over 40 hours more in a week. So that's about 16 to 20 hours in a day, over and above what we're expected to work. But you get paid for it. And doctors are the only profession in South Africa that are being paid overtime that is called commuted overtime. So it means this overtime is commuted because it comes in as part. You don't have to almost claim it. It comes in as part of your salary, but it's calculated on the basis of the work of the hours that you've worked between 15 and 20, 64 and 80, and then you are paid with your basic salary. So for some doctors, it accounts up to about 30% of what they earn. So you can imagine what impact it has if you wake up one day and that money is no longer there. The opportunity cost of you having worked those hours when you could have worked somewhere. Because doctors are actually in demand even in the
private sector. I mean, it means people are not going to work this overtime.
And these are serious, very senior clinicians who are responsible for the training of these doctors who are being trained to be specialists. We call them registrars. The interns from the HPCSA, the doctors who just came out of the training, they need supervision for about 2 years. So they can't work. They cannot take legal liability. So if a patient dies and was seen by an intern, the intern cannot take that responsibility, but the senior who's not there is supposed to take that responsibility because they're supposed to guide. Now, so it's something that I think we do need now the minister to come out again and be clear to his MECs and all of the HODs in the provinces to just stop and allow the MAC to do their work.
Yeah, it does seem like a bit of a mess. Appreciate your time. Dr. Mzu Theo Nodikida is the CEO of the South African Medical Association.
Current events, developing stories,
tough questions,
your voice making a difference.
This is Breakfast with Bongani Bingwa.